Unit number 7 is called Allied Health Professionals, and the exercise number 1 says make word combinations using a word from each box. Look at A, B, and C opposite to help you. Ambulance, artificial, club, contact, health, intraocular, occupational, social, foot, lens, limb, worker, pressure, technician, professional, and therapist. The word combinations are ambulance technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, and social worker. Exercise number 2 says which allied health professional could be best help the following people. Look at A, B, and C opposite to help you. A young unmarried woman who has just had a baby, midwife. A woman who is having difficulty using her right arm following a fracture, occupational therapist. Someone who needs glasses, optometrist. An elderly woman who has had below a knee amputation, prosthetist. A man whose wife has Alzheimer's disease, social worker. A man with a fungal infection on his feet, podiatrist. The last exercise says complete the text. Look at A and C opposite to help you. The prosthetist works with a patient of all ages as member of a clinical team based on a large hospital. The patients may need a prosthetist as the result of an accident or have been following a disease such as diabetes. Alternatively, they may have been born without a limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible chance. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as part of the outpatient service and also visits the other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require orthoticians to help them walk, and many older people need special shoes to correct foot problems. If damaged, any part of the human skeleton may require some form of orthotist. The orthotist may be needed to reposition of the body or relieve pain. Unit number 9 is called Hospital, and the first exercise says complete the table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, admit, assess, discharge, operate, refer, and treat. Noun, admitted, assessment, discharge, operation, referral, and treatment. Second exercise says make word combinations using word from each box. Look at C opposite to help you. Acutely, assessment, on, referral, waiting, unit, letter, list, duty, ill. The word combinations are acutely assessment, referral letter, waiting room, duty unit, and ill treatment. Which hospital departments will be the most appropriate for the following patients? Look at A, B, and C opposite to help you. That's the third exercise. A woman who is in diabetic coma, emergency department. A patient who has just had a radial prostatectomy, urology department. A patient who is to have a lesion removed, dermatology department. A man with foreign body in his eye, ophthalmology department. A woman with a terminal abortion, obstetrics and gynecology department. The last exercise says complete extract from an information leaflet for a patient. Look at A, B, and C opposite to help you. Informations for outpatients. When you arrive at the clinic, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the assessment you are going to have. You may need um, some, may, some undergo tests such as an x-ray, which could mean going to another department, or you may refer to other professionals such as physiotherapists or dietitian. You may need to revisit the clinic. If the staff at the clinic wants you to see you again, another appointment will be arranged for you. If you need to be admitted to the hospital for more treatment, either as an inpatient or outpatient surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. The unit number 10 is called primary care, and the first exercises complete the sentences. Look at A opposite to help you. Children over 60s and people with some chronic diseases do not have to pay for treatments in UK. Patients with mobility problems may unable to go out. They are housebound. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. Care outside working hour is known of out of worker treatment. Second exercises make word combinations using a word or phrase from each box. One word can be used twice. Look at A, B, and C opposite to help you. The words are change, make, perform, refer, run, supervise, take, messages, staff, appointments, home visits, dressing, a clinic, a patient, and minor surgery. The word combinations are change staff, make appointments, perform minor surgery, refer a patient, run a clinic, supervise home visits, take messages, and change dressings. The third exercise says which member of a practice team will be responsible for each of the following: running a clinic for pregnant woman, midwife; teaching a patient how to strengthen his broken leg, physiotherapist; letting the GP know that a patient can come to her appointment, receptionist; running a clinic for people who want to lose weight, dietitian; visiting a patient who has just returned home after an hernia operation, health visitor; carrying out checkups on children in a poor neighborhood, community nurse; organizes cover for an absent doctor, practice manager; complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. 1 to 2 p.m. practice team meeting over sandwich lunch. 2 to 4 p.m. afternoon consultations. 12 10-minute appointments. 4 to 4:20 p.m. coffee break. 4:20 to 5 p.m. check with the receptionist for messages, deal with the home visits, and repeat the request. 5 to 6 p.m. paperwork, referrals to secondary care, admin tasks, telephone calls to patients, private medical examinations, and last 6 p.m. phone switched to answering service.